Hey, welcome to today's episode of Kids Town Corner. Today we're going to talk a little bit about trauma and injuries that happen at home. So just kind of what you can do and what type of injuries that are some of the most common that we know about.
Yeah, it seems like whenever there's trauma to the face or the mouth, it seems to almost always be these top front teeth.
Yeah.
They're targets for trauma. And along with the teeth, there's also a soft tissue connection that it attaches your lip to your upper jawbone, and so it's called a frenulum, and so it gets torn a lot when there's trauma to the upper face as well. So we'll kind of go over some soft tissue trauma and some trauma to the teeth. One of the most common things that happens, and we've talked about it a little bit, is an avulsion, where kid gets hit. Again, it's usually those upper front teeth, and the entire tooth sometimes gets knocked out.
Yeah, and that's the worst injury possible. I mean, that's one where as quick as you can, you want to be getting a hold of your dentist, and if you're comfortable, not many are, but in rare occasion, if you're comfortable to put that tooth right back in, awesome. Even if it's turned the wrong way, it'd still be better than nothing. They'd have to hold it in place because it's going to slide right back out. But if you can do that and get to the dentist as quick as possible, great. You're close second, put it in some milk, get the dentist as quick as possible. They'll get things all splinted up and go from there. We've done a longer video, if you look through our video series, talking specifically more about what you do with a knocked out tooth, but that's kind of the nuts and bolts of it.
Other times the tooth might get knocked and it might not come all the way out, but it might be displaced. It might get knocked out of its position sometimes. So the best thing to do, again, if you're comfortable, the best thing to do in that situation is try and pop it back into place yourself if you can. But again, this is another injury where the sooner you can kind of get a hold of the dentist, you know, the better, so that if you're unable to reposition it yourself, we can try and reposition it for you.
Yeah, in fact, that injury has happened to two of my own kids. And one of them, it happened at dance and I wasn't home and I didn't see her for a little bit, and by the time she got home, it was luckily on a baby tooth, but it had been pushed back a little bit. By the time she got home, it was pretty solid. It had been well over an hour. They didn't think it was a big deal or whatever, and so I tried to pop it back in place. It was too late, so we left it, and it was a baby tooth. You know, it was back a little bit for a couple years till it got loose and came out. It was all right. With the baby teeth, sometimes that's where we end up. You know, they're going to be displaced a little bit, and we don't really have to do too much. You're not going to go so far that you potentially pop the tooth out. So you want to give it a chance to at least stay, even though it's a little malpositioned. The thing you're definitely looking for there is if they bite down and they can't get their teeth together, the tooth's back too far that it hits their bottom teeth. That's when you know one of us needs to get involved. But when in doubt, you call us. We always have one of us on call, and a lot of times we'll have you send a picture and we'll evaluate it looking. That's the beautiful thing with the phones now, is we can get a real good look at what you're seeing so that we can make a real good judgment. Okay, we need to come in or we don't. Here's what you should do, and we go from there.
Right. So a tooth gets hit, it's got a few choices. One, get knocked all the way out. We went over that. Two, get partially displaced, but not come all the way out. The third thing that can happen is it can stay in place, but it might fracture. So the top crown of the tooth could get knocked off. You know, the severity of that depends on how deep the fracture goes. If the fracture's confined to the enamel and the dentin of the tooth, then it's really not that big of an issue. It's not an emergency. It's something that we can replace that missing tooth structure with the white filling material that we use all the time and just kind of build the tooth back up. However, the fracture can be low enough on the tooth that the nerve actually gets exposed, and that's a different story.
Yeah, for sure. At that point, one, you're going to know because there's going to be extreme sensitivity, even to like room temperature, air, things like that. You know, it's hard to even breathe without it just really being super sensitive. And another way you can tell, you know, sometimes when you chip a tooth, you hit it hard enough, there's some bleeding around the gums. But if there's any bleeding that's coming from just a little teeny pinpoint area right on the tooth, you know that nerve's been exposed. And a lot of times what we'll do there is have the parents send us a picture, kind of that view from the top of the tooth, just to get a good look and see where that's at. And if we think there's any type of exposure, then a lot of times we'll cover that up and at least get it patched up and go from there to where there may be potential for root canal, things like that later on. With the baby tooth, you know, there's different things that we may or may not recommend there. Sometimes you just kind of have to finish the job and pull the tooth. Other times there's just depending on how much time's left. So there's a lot that goes into it. There are different injuries that really don't need to be seen. Those all are some that we would want to see, but there's a lot of them that aren't as complex or we really don't need to come in for, and it's something that you can take care of at home. So. Yeah, the torn frenum is one.
Right. So that soft tissue attachment, if it gets torn, you know, ironically, a lot of times we remove those soft tissue attachments ourselves with the laser. We call it a lip tie, and so it can act as a plaque trap and make it difficult for you to clean those upper teeth. It can cause a space or a diastema in between the teeth where the front teeth can't come together. So there's reasons why we'll go in and actually remove those ourselves with the laser for some of our patients. So if it's something that gets torn because of trauma, it's not something that we're gonna suture, you know, or put stitches in and try and reattach the frenulum, because a lot of times we don't really want it there much anyways.
Yeah, they just did a nice little free procedure, so there you go.
They saved you the bill for us doing it for them. So keep in mind, whenever there's soft tissue injuries to the mouth is highly vascular, and in some ways that's great. When the mouth is highly vascular, it heals nicely and it heals quickly, but it also bleeds like crazy whenever it gets injured. So sometimes those soft tissue injuries to the mouth look a lot worse than they are. That, and you've got all this saliva in your mouth already. So a little laceration in the mouth with a little bit of bleeding, it mixes with that saliva and it can make it look like it's a lot worse than maybe what it actually is.
Yeah, absolutely. So really, if that happens, and it is the #1 most common injury in toddlers, they've got this big old head, they're trying to learn to walk and they're falling, and they lead with that heavy head and they land just like that, right on their face. That happens all the time where they don't get those hands out in front. And so they fall down and they hit even on the carpet, whatever, and that tears. And really all you need to do is just put some pressure on it from the outside, a little washcloth, whatever, and within a few minutes that should really stop. Within 5-10 minutes max, that should clot up and they're good to go. They might have a little bit of a fat lip, a little ibuprofen or Tylenol, and they're all set. Happened with my kid. We were just getting ready to go out to the 4th of July parade, big Kaysville parade here, and we're about ready to run out the door, and he's just chugging along, little 2-year-old, maybe he was 3, and he fell and face first. First thing, I'm like, okay, how's the teeth? Teeth were good, but he was just gushing with blood. So I've seen it in my own kiddo, but yeah, just a little pressure there, and he did himself a little favor, a little free frenectomy there, and then lip ties, all taken care of and done deal. So yeah, there's a handful of those just simple injuries, but if there's any doubt, honestly, don't hesitate to get a hold of us here at Kidstown. One of our doctors is always on call 24/7, to where we're happy to help with any questions. And typically it's going to be sending us a picture, then we go from there, go back and forth, and sometimes we're able to take care of it just over the phone. Sometimes we're coming in here. So we're happy to help there with any trauma questions you have. Something we're super comfortable with. We did a lot of training in our hospital programs to where, you know, we saw all kinds of crazy stuff. So now the little neighborhood stuff's no big deal. So thanks for joining with us today on Kidstown Corner. Hopefully it's something that was helpful to you. If you felt like it was, please share it. Also, any comments below, good or bad, let us know. We'd love to answer any questions, and we'll see you next time.